Could you imagine taking your car to a mechanic because it's got some issue? Would you expect the mechanic to look all over your car, run some diagnostic tests, decide what is wrong with it, and start a treatment plan, then write up a whole report about it in 15 minutes? Of course, you wouldn't expect somebody to do that, but that's what we ask medical providers to do. And we're dealing with complex machinery. We're not dealing with a car, we're dealing with human bodies. And I think it's crazy that we expect providers to do all of this amazing detective work and analysis and get everything done, including a report of what happened in 15 minutes. But that's the landscape out there in medicine today. And so, if you want to work in medicine, you have to learn how to do that efficiently and effectively. And so, today I am interviewing a PA who precepts a lot of students. He's also a life coach for PAs and other people that work in healthcare. And we're going to specifically talk about efficiency. Hi, it's Michelle with the Medicine Couch. Thank you for joining me. And this is a topic near and dear to my heart because it has been one of the biggest struggles in my career. So I really do hope that you can take away certain tips and ideas to help improve your situation at work.
Hello, everyone. My name is Klaus Grim, and I'm a physician assistant. I graduated from PA school in 2018 and decided to practice in emergency medicine. In the ER, I also rotate through an urgent care with my team of PAs, where we precept PA students, and I'm the lead preceptor. During COVID, I went to coaching school and because I was experiencing burnout, and I'll talk a little bit more about that later.
It's hard to believe, isn't it, when if you tell people in other professions that you graduated in 2018 and in a couple of years already had some burnout going on. But that's the reality of medicine nowadays.
I feel that we are seeing higher rates of burnout earlier in people's careers, just the increasing demands that healthcare is putting on healthcare professionals.
I think a lot of people might feel that there's something wrong with them, especially when it's a newer career and you're like, "Oh my God, I just, I suck. What's wrong with me? Why am I struggling so hard? Why am I burning out?" When people have been PAs for 20, 25 years and they say they love their jobs. So I think it's important to let people know they're not alone and that there are reasons behind that. So we're going to focus today on talking about efficiency.
I think efficiency spans so many dimensions of your job from, having a healthy team to getting out on time. But ultimately, it comes down to how are you best providing care to patients in a sustainable way that is, meeting all their needs. Emergency medicine, we're open 24/7. So you can't say no to patients, right? So you have to be able to meet the demands of, the 10 ambulances that just came up, and the 20 patients that just came in to check in from the front. And then the urgent care, previously there was no cap to the amount of patients we could see. And based off unrealistic expectations, that's something that our team has been able to negotiate where we see a set number of patients a day. So I think most fields that we're in go by appointments. So if you go by appointment times, if you don't have great efficiency or good time management, you're delaying patient care. And you know how angry some patients get. But I think the biggest thing is the mistakes that can lead to both patient harm, but mistakes in yourself in dictation, that say you wanted to document something and you totally forgot just because you're trying to rush to finish a chart. And I think that goes back to that just stress, the anxiety, the overwhelm that you can develop as a result of not being efficient and not having great time management, which ultimately lead to burnout for a lot of people. Then I think a lot of it as well is like work starts to follow people home. Like if you're not finishing your notes on time, some people are going home and writing their notes, or they're staying in the clinic later than they're supposed to because they didn't have the best strategies in order to complete them on time.
So I'm curious, and having said that, if you're somebody who admittedly knows that you're bad at time management, like, is this really fixable or is it just something ingrained in your personality and you just have to try to find a slow job that you can handle? What are your thoughts on that?
We're providers. We are continuously learning. These are things that just they don't stop once you become the provider or start your first job. These things can constantly grow and adapt. And I think you can also listen to 1,000 talks on efficiency and how to be a better provider, but it really all comes down to you. Like, you are completely different from the colleague who's practicing in the same specialty, in the same job as you, and your challenges are completely unique to you, and your ability to overcome those challenges are completely unique to you. So it really comes down to figuring out what it is that you're struggling with and becoming aware of it and start to make those changes based off that awareness.
What are the top things that you think can really help providers get more efficient and be better at time management?
First is that awareness, having that taking a step back and looking at the bigger problem, right? A lot of people like to say, oh, it's me or it's the organization, but there's oftentimes a bunch of little steps or little problems within. So once you have that awareness, and if you're willing to give it a try yourself, right, start to take a small baby step towards making changes based off maybe one thing at a time, right? Life's
Yeah.
a journey, change is a journey. It took us, what, 6 or more years to become PAs. It takes time to improve and change in the ways that we've been practicing medicine every day. But I work with a lot of new graduates and a lot of students, and a lot of things that I tell them is to leverage what you have. So, for instance, if you're struggling with having the general knowledge base, for instance, let's talk about urgent care. So, a patient comes in with a complaint of, let's just say, sinus congestion, right? And you're maybe lost or forgot what the guidelines are for sinusitis and when to give antibiotics, which antibiotics to give. Use up to date Hippocrates, what other systems that you have to kind of refresh yourself on diagnoses and treatment guidelines, right? You're expected to know such a large breadth of knowledge in medicine, and it's so difficult to remember everything. You're human, right? And the more you kind of refresh yourself, the better, you'll be ready to handle the next patient.
To add on to that, and maybe you were
Yeah.
getting there too, but taking some time outside of work to look at like different apps that can be useful on your phone and get familiar with them, because it's one thing to put them on your phone and try to use it when you're in a hurry, than to spend time and get really familiar and know what you can find where. I know I've had to do that with some apps. Like, I had them on my phone and I thought, oh, those would be great. But then I try to use it in the heat of the moment, I'm like, "I can't find anything." So,
Oh my
I
gosh.
found out I gotta do that in my downtime and figure it out.
Oh, 100%. Like, how many times do I go to MD Calc? I'm like, oh, the spam, and how do I get through, find the right resource? No, I totally agree with that one.
Yeah,
And
yeah, and
actually,
set up your
yeah,
favorites in MD Calc, like
exactly.
star things, yeah.
Oh yeah, and like the Wells score, whatever that you use most often, 100%. And that actually
Yeah.
kind of brings me to my next actually pointer is my chief in the ER once told me what separated many of the residents that he works with and the PAs that he works with was that the resident went home after their, busy day and studied their cases every shift. And he said us PAs really didn't do that as much because we were so exhausted from drinking the fire hydrant, right, from school, that we were like, no, 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 we're gonna learn it on the job. So that's something that I took to kind of heart when I started.
I guess realistically, we need to still be in that student study mode for at least the first year probably, right?
Yeah, totally. And then even more so if you're switching a specialty, right? Like if I went into
Yeah.
dermatology, I'm like, I'd have to refresh on these rashes. Though I see rashes all the time, I'm like, I'm gonna have to kind of refresh and kind of keep up to date with all that stuff. And that's a lot of stuff. What I actually even do now is like if I send somebody to the ER from the urgent care or to a specialist, I try and follow them and just and say, oh, like what was the true diagnosis? Was mine close or accurate? Right? Did I do the right thing for them? That's also a kind of learning-based tip that I find and helps me grow as a provider.
Yeah, that's valuable. Learn from others. And I guess even other providers in your space, like if you work in urgent care and you've got some downtime because it kind of comes in surges, I imagine maybe even looking through some of the other cases that your colleagues are doing, see what they're doing.
We have a very collaborative process, my team. We love to share cases and knowledge base, and it's always a strong team environment. So that's 100% something that can definitely be done. Another thing is sometimes we cannot change the aspects of our job, like for instance, the volume, but we can learn to adapt if we're looking to stay within that job, right? To help with the efficiency. So Things like creating templates are huge. That was one thing I did when I first graduated is I created a bunch of templates. I would see what sore throats, then I would differentiate that to strep throat where they gave them antibiotics, from UTIs, conjunctivitis, right? The most common complaints that I were seeing, I would have like a built-in HPI review systems of the things that I always ask the patients, as well as also having a physical exam, right? Knowing how to document for the specific complaint. And then also even patient discharge instructions. I had these templates built out so that I could just copy and paste them and then obviously edit them to the patient and make them individualized. But it was definitely helped improve my workflow.
Yeah, and I love what you said about having an HPI with the questions that you need to ask. Somebody's walking in and they're having cough and congestion stuff. There's certain questions you need to ask, and you need to remember to ask the ones that rule out the, very serious things that you don't want to forget to ask those. Even if you're 98% sure they're walking in with a cold or flu or something, you still need to ask those other questions, right? So, and I've done this a couple of times, but I didn't spend enough time to set it up where I would have like a dot phrase for a particular chief complaint that would have all of those questions in there. So I didn't forget and didn't always have to scramble and look up, oh, yeah, what are the things I have to make sure I cover? Like back pain, are you having saddle anesthesia and bowel and bladder incontinence? There's some things like that you just have down, but there's other things you don't see enough that, but you have to remember to ask those questions.
And there's nothing wrong with also like going like you asked your questions, right? And then you've created these questions in advance, right, in your template, and you're like, "Oh, I forgot to ask that." Okay, go back into the room and just double verify that the patient didn't have that, right? And then it's just going to become like common sense to you and flow so naturally the next time.
Now, templates, do you create your own or do you sometimes borrow, or have you ever talked to IT about can they help us set up templates and dot phrases and things?
It all depends on your EMR system. We now are Epic, and so with Epic, we also use Dragon to dictate. I don't know if you ever used Dragon, but
Yes,
there's a
I have.
lot of features with that you could use that I don't think majority of us utilize. And same thing with Epic, right? With the dot phrases, like there's so many different ways in which you can do things where you can create like asterisks and don't quote me on this one, but there's I think one of those F9 buttons or something like that. You can kind of toggle through and it can help you efficiently write your charts based off of those asterisks that you put in there.
They have like field choices. Like if you're
Mhm.
have discharge instructions that are roughly the same, but there's different, it changes a little bit based on what that particular patient has. You can actually set it up where there's field choices so that when you tab to the next one, you've got like four or five choices so you can put the appropriate thing in.
Yeah, and I always found IT to be very approachable for that in terms of like helping you individualize that. And actually, speaking of that, a lot of my colleagues will go into a patient room and write down notes, right, on a piece of paper. Mine never really functioned that way. I like sitting down next to the patient, talking to them, and then grasping all that information, going back to the computer, writing a quick HPI in the physical exam. Like I do that as quick as I can after I just met the patient, where it's all nice and fresh. And then oftentimes, if it's really busy, we'll save my assessment and treatment plan dictations towards the end of the day or when I have a second to catch up, because like to write detailed discharge instructions. So I don't forget kind of what I recommended to them based off of that. So that does help me a lot too. I find I oftentimes recommend that for efficiency purposes to my students as well.
How do you remember the special stuff about each patient?
That is a big issue for a lot of people is remembering all those little details, and it is for me too. So that's why that history and that physical is usually done pretty quickly after meeting the patient. In terms of, like I said, in the assessment and treatment plan, in terms of documentation, I have a standardized discharge for most complaints. But if there's something that was unique, something that was different, somebody that I referred somebody to, I make sure that is in my discharge instructions so that when I do write the assessment and treatment plan, I can just refer back to that and be like, oh, so I referred this person to urology because they're having frequent UTIs. They just keep coming back to the urgent care, growing weird bacteria, for instance, right? And then I'll write them a note. Hey, you were evaluated for a urinary tract infection because of your frequent UTIs. It is recommended that you establish follow-up with the urologist. Here's their contact information, and that way I always reference the discharge instructions.
Because you have to get the discharge instructions in for the patient to be able to go,
Mhm.
so you can that's smart that you can embed little code things in there that you know what it means when you look through the discharge instructions, so you can add that back into your assessment plan. Well, any medications you have to order or referrals made, do you try to always get those done when you leave that patient room before you see the next patient?
I don't personally write on the computer while I see the patient. Some people like that. I personally prefer to do it on my own time. And so I'll leave the room and tell them, hey, I'm sending you a prescription for amoxicillin. Just verify your pharmacy. And then I go back to my computer and I send everything. I put all their information, discharge instructions, all there.
I think it's important that people spend some time, especially on the things that they see, like the top 3 or 4 things, 5 things that they see all the time. If you know exactly what exam you're gonna do every time, and you have that down and you create a template for that, and that's there, then you really only have to note somewhere, even if it's just writing it at the bottom of your HPI, physical exam, they had, um, discharge out of the left eye or whatever. At the end of the day, if you're trying to finish your chart, if you only note the abnormal stuff, then you know everything else was normal. If you have a routine that you do every time. So I think that's why it's important to standardize that. Do you like that idea or do you think that's problematic in any way?
No, I mean, I think what works for somebody may not work for the next person, but I think that is a strategy that could work for a lot of people.
I think I interrupted you again. More tips? Do you have more tips to share?
We work with a lot of students, both in the emergency room and the urgent care. And if you have a student, some people get literally stressed out, right? They're like, oh my gosh, I have to manage 50 patients and I have to teach a student. I'm like, yeah, but also they could be very beneficial to you. I always tell people, like, utilize them. So, for instance, with the PA students, oftentimes they have direct patient care experience. So, for instance, in the urgent care, I have them take vital signs if it gets really busy. And some people will say, well, that's not what they're there for. I'm like, well, I disagree. I think they need to be able to learn how to do the basics and remember that it's a team environment. Also, like for instance, like say you have a big laceration that comes in and they have experience in suturing and you feel comfortable with them suturing, have them suture the patient while you see the other patients and then come back and round on the other patients together and kind of give an update and teaching moment at that time. But I think the biggest thing that kind of think that I want to hit on is like, and this is kind of my whole coaching passion is that as healthcare professionals, I think we're not given the care that we give to other people. And so when you're under stress and feel like you're really struggling, give yourself a break. Like I don't get a lunch break at the emergency room or the urgent care, right? It's not built into my schedule. We take it when we can, but give yourself like 5 minutes. Go outside, get some fresh air. By doing so, you're really going to be able to refresh and better able to take care of the next patient because you're like, oh, wow, I can take a breather for a second.
Yeah. And it's counterintuitive, right? I mean, we think, oh my God, I'm so far behind. I've got all these charts to do. There is no way I can stop. And yeah, you end up not having a break for the whole day. I talked to a PA who I interviewed that worked in New Zealand, and I'll put that card up there if people are interested in finding out what it's like to practice medicine in New Zealand. But she's an American PA who went there and worked for a year or two, and she was talking about that they make you stop working at lunchtime, like that you are not allowed to sit in your office and chart. They make you, get out, take a walk, or just socialize with other people. Just get out of your office and she said that it was really hard to adjust to that, but that she found out she was far more efficient when she went back to work after the break because her mind had had a chance to clear and she could focus better, I mean, so while we may be hesitant to take a break or to step outside and get some fresh air because we're like, oh my God, I've got so much to do, it actually can help you get through your workload faster. Totally
Yeah.
counterintuitive.
Yeah, right. Who knew just taking a second when you're so busy for yourself will actually serve you so much better and the people that you work with? 100%. But I think actually that leads to my last tip that I have and I think that when you're starting to figure out that the things that are enforced on you are unrealistic, right? Gather your information in a professional manner, and say you're working in urgent care and the volume is too much for you and you're like, I just need a new job. Well, talk to other people who are in the same specialty, maybe, practicing in a different organization, and see what it is for them. Like, start to bounce things off from the pay to the volume to the resources, whatever it is. Then, once you have enough information, advocate for yourself. Discuss with your supervisor, again, in a professional manner. Nobody wants to be told, poor me, like, you hate me, whatever, right? But you want to come to it in a professional manner and say, hey, I'm struggling here. I'm getting a lot of stress and anxiety. I'm worried about my patients. Can we look into this? Can we look into the patient volume in the essence of, can we make maybe appointment slots, or whatever your specific circumstances is, and see how you can address it from there. You'd be shocked about how many times people start to advocate for themselves in these ways. And they're like, never mind, I'm not leaving. My boss listened to me. He agrees like
Oh,
that.
wow, great.
Yeah. It's not for everybody. Some people are like, nope, I
Right,
got shot down. And then that career changes imminent, whatever, right?
right.
It's different for everybody.
How do you know whether most of the problems are your personal efficiency problems, whether it's unrealistic management expectations, or whether it's things in the office that are inefficient? Most likely it's a combination of all of them, but how do you decide that and figure out that?
I say it's not an easy answer, and it comes from, I think it comes from self-exploration, right? And it's multifactorial. You have to think about things in terms of like a resource setting or a team issue that's causing efficiency issues. For instance, at my urgent care, we see 4 patients an hour, so every 15-minute time slots. And sometimes that's unrealistic because you may get somebody with multiple broken bones, or they have a laundry list of complaints, or this large laceration that takes like at least 30 minutes to do, or if they check in late, or even all the details that we have to put into each note for billing can really delay being an efficient provider, because your environment did not set you up for success in this way.
We all can come up with examples in our offices of things that could flow better. And it could be little things like when a patient comes in and they're complaining of knee pain. Does your MA already have them in paper shorts or in a gown with their pants off? And that doesn't take long to fix. You may get some feedback from MAs who are busy or whatever, but if you think about any of those processes that could speed stuff up, if somebody comes in with, especially female, any kind of urinary complaints or abdominal pain, you've got a urine already done and an HCG done if they're in childbearing ages. If those processes are already in place, then that just takes weight off of you. It makes the whole process smoother.
You're right. That is huge. And it's important, right, to have the patient undressed when it comes to certain complaints, or to be able
Yeah,
to evaluate the complaint. And that's something that is so
right.
simple that we all can do. The other thing is to talk to people. And I recently had this interaction with a student of mine that went to practice in urgent care afterwards. And she had called me kind of urgently one day, was like, I need to talk to you. I don't know if what's happening is unrealistic or is it me. Within 2 months of graduating, she was expected to see 4 patients an hour. She only had 20 hours of supervised training. She was expected to read all her radiographs, and then discharge the patient without the radiologist interpreting the study. She was in charge of giving her own injections if the MA wasn't trained to do so. I mean, a laundry list of things where I was like, it's not you. You need to have a system in place that supports you, and how to approach that from there. And so that's kind of how we worked on.
Yeah, if you're a new grad or you are a seasoned provider but transferring into a new specialty that you don't really know how it works, it's hard to know if it's you or if what they're asking for is realistic. So talk to others. It's not always apples to apples when you're comparing against clinics, but you can get an idea and can help you at least identify whether it's you or systemic problems. And that's an important
100%.
place to start.
Yeah, totally.
Tell me why you got interested in coaching, and tell me a little bit about the training that you went through.
During the pandemic, I got a little burnt out because of the high volumes and lack of resources. There was no staff, the pay, right? They were cutting hours. And I was like, I'm experiencing burnout. And I'm only like 2 years into this field. How is that even possible? So, what was interesting was during my veteran affairs rotation when I was a PA student, part of their curriculum was to work with a life coach for 3 sessions. And I was like, I don't need this. Like, I don't need a life coach. My life's dandy here. I'm like, I'm going to graduate soon. I'm going to have a career soon. It's going to be great. Anyway, so I worked with this woman and she was like so kind, positive. She didn't let me slip into this like poor me. It was
Yeah,
all forward thinking. And it was so empowering just to reflect on the work that I was doing and talk about my goals and my desires. And though they were like small goals, like I think they were like at that time were, how do I exercise when I'm driving 2 hours to work or to this clinic?
yeah,
And then I'm working 12 to 16-hour shifts. Like, how do I fit that into my schedule? And I loved it. It was like completely personalized to me, and I was able to better make changes as a result of it. So that
great.
was my experience with coaching. And so when I got burnt out, I was like, that coaching experience was always in the back of my mind. I was like, wow, that was something great. And
Yeah,
so I looked at like finding a coach and this program came up called IPEC and it was a very well-known program and it allowed me to complete the course at home virtually like obviously during the pandemic and the program was marketed towards helping you experience personal transformation while also developing skills to help others do the same. So I
oh,
was like, well,
nice.
this is a
Yeah,
win-win. Instead of just hiring a
right.
coach, why don't I just go to coaching school? So it was a little bit of an investment. I didn't really see it as becoming a coach, but more so just actually like developing the skills of a coach to help other people,
Right.
like
Yeah.
patients mostly. But then I just saw so much transformation in myself through this coaching program and I loved it. I fell in love with it. And I was like, wow, I'm making so many positive changes that where is this in healthcare? And so I was like, okay, well, maybe I'll create a little business out of this. Let's see how it goes. So I started coaching a lot of travel nurses that I worked with, and then it spread through there with physicians, PAs, NPs, and I get to help them through all facets of things.
And you also are involved in a podcast, is that true?
Yeah, so I partner with 4 other coaches, and we have a podcast called Transforming Healthcare Coaching. We are all healthcare experienced in different ways. So our founder's a critical care emergency medicine physician, and we have a mental health pediatrician, ultrasonographer, and occupational therapist. And we're on Apple, Spotify, and YouTube, and we talk about everything healthcare. So we kind of dive into the hearts and minds of healthcare professionals and leaders as well, because we hope to inspire change from the top that will create a ripple effect down and kind of
Right.
offer people a front row seat to conversations that illuminate paths to personal professional transformation.
If you are struggling and you have decided that you really need to leave your office and you're looking maybe to do something else, to stretch yourself and go into another specialty, but you're not exactly sure how to start doing that, well, I have a video that can help you. I will link that here. Thanks for watching. And as always, take care, stay sane, and I'll see you next time on the Medicine Couch. Bye.